Hello and welcome everyone. Thank you for joining us for a conversation about men's fertility health. This is Ann Mullen from Cycle Technologies. I'm happy to have as my guest Dr. Lee Barron, Associate Professor of Nursing at Southern Illinois University, who is joining us remotely. Hello, Dr. Barron.
Good afternoon, Ann.
Thank you for joining me to discuss this important topic. Dr. Barron, you've studied the topic of fertility for quite a while and have discovered and researched some interesting associations and influences that fertility health has for a person's overall health. And maybe some of our audience may even be aware that you and I have conducted other webinars on fertility topics. And I wanted to mention that it was at your suggestion that we discuss men's fertility health in a little bit deeper detail. So here we are.
Yes, here we are.
So our goals for the discussion are to answer 4 questions. First of all, why do we want to talk about men's fertility health? And how is fertility health evaluated for men? What harms a man's fertility health? And finally, what supports a man's fertility health? And of course, if there's any questions or any other considerations, we will also cover those at the end. So why even talk about men's fertility health? Why are we exploring this topic? So Dr. Barron, it was so interesting to read your article on men's fertility health from the perspective that we in our work, and a lot of people in general, focus on women and women's health when we talk about fertility. But you make some interesting points about why men's fertility health should absolutely be front of mind. And one of them, and I've heard you make this point more than once, is that men are usually not that knowledgeable about their sexual health. And they're also far less likely to seek health care than women are. Is that true, or is that just kind of rumor? Or
Oh no, that's very much true. And I actually have 2 sons in their 20s, and neither one, they're very typical about not seeking out health care.
Even with you as their mom?
Well, they can ask Mom.
Okay. So they have that
But they're not going to ask me about their sexual health.
Okay, well, I can understand that.
Yeah. So, yeah, in general, men don't seek health care until they need it. But I think that the idea of prevention is becoming more prevalent in our society now. Certainly, that's one of the things that the Affordable Care Act has pointed towards, is getting more folks into prevention, and you cut down on the cost at the other end of the spectrum.
Well, and I think that really is a good segue into the second point that you've made all along when you talk about fertility literacy, or people knowing about their fertility health, is that your fertility health, and for men and for women, reflects your overall health.
And it does. And so and the thing that stunned me, I had really concentrated on the women for very many years, although I did include men in my original preconception work. Back in the 80s. I was involved in preconception counseling as a model for couples that were coming to hear about what they needed to do prior to getting pregnant. And at the time, I did have a category for the daddy. However, that's as far as it really went. We didn't, and even in the national guidelines, there are 6 recommendations on preconception health, and only 1 is targeted to men.
Oh, so they are kind of left out, it seems.
Yeah, they are. And so, but women do not bear all the responsibility for reproductive outcome, or what the babies, whether they can get pregnant, and whether or not the baby, that it's a successful outcome. Because when a miscarriage occurs, that's tragic, and it may not be one partner or the other. You may never know, but there are 2 people involved in the making of a new human life. So I really kind of thought that we needed to do more with educating on how to be healthy with your fertility. And in that, I had already known the connection that's been discovered over the past, probably decade and a half, maybe more, about women and the connection between their irregular cycles and later developing cardiovascular illness and irregular cycles and developing diabetes. And then when women are pregnant, people have this conception that it's a timeout, but really the health in pregnancy is what you do before you get pregnant affects your experience of pregnancy, and your experience of pregnancy affects your health after. So when I began to look into the men's health, I was stunned actually to find out it's the same paradigm in terms of the same guy that has poor semen quality are the same guys that have later cardiovascular disease, and same guys who have erectile dysfunction are the men that develop later cardiovascular disease.
Yeah, and I think those are all very pertinent points, and I did want to talk about those specifically in detail a little bit further in our discussion. I think what also you were saying is that a lot of people don't think about it, but our final point is that men do share the biological risk and reproductive responsibility. One thing I was wondering about, and you may have read this, but I had seen the National Infertility Association just made the statement that if a couple's having problems, it's 50% of the time the man, which a lot of people, think it's usually a women's issue.
Well, yes, but and for years we had the formula 40-40-20, which was 40% of the time it was the woman, 40% of the time it was the man, 20% of the time it was the combination of the two.
I didn't hear that one. I'll definitely make that one for our next notes, 40-40-20.
Yeah. And so the idea that he needs to be taking care of himself in this regard is really an important one.
Well, I have here the health factors for men, and I think you've already started to talk about how the importance of preconception health or the condition of a man's fertility health really has an indication or is an indicator of his overall health and even his future health. So let us go on to, I guess, the basics of how you determine or evaluate a man's fertility health. And you've pointed out in some of your articles that it's actually pretty simple, even though it can also have complications. It's all about the sperm. Is that right? The good quality sperm?
Well, it's not only quality sperm, but it's quality semen as well, which sperm are only a part of that. And so the semen analysis is what has long represented the standard test for evaluating a man's fertility. It's not perfect, but it does tell us a lot about their fertility status. And so we don't tend to tell men to run out there and have a semen analysis just to have one. Usually it's reserved for a couple that is experiencing some difficulties getting pregnant. And here's the order of things. You always get the semen analysis first because it's a cheap test. It's a cheap test. Okay. It's easy to obtain. The tests for women tend to be more complex and more difficult to obtain. So establishing the male's fertility status first is very important. And so
well, it's good that is an easy test.
Yes.
Well, another thing you had mentioned that I wanted to ask you about was, besides that test, you mentioned sexual performance. And I assume that this might have to do with maintaining an erection or achieving one. Is that what you were speaking of?
Not really.
Oh,
okay. Obviously, it's a given that a guy has to be able to have an erection and an ejaculation in order to impregnate a woman naturally. Mm-hmm. So what I was talking about there was more so that erectile dysfunction follows later in life with men who have had trouble with the factors that trigger fertility problems. And one of those, it's our Western lifestyle in some sense. We have a high obesity rate, and for every 20 pounds a man is overweight, his risk of infertility goes up 10%. Mm-hmm. So that's really profound.
And I think that that's a topic that is pretty prevalent in our modern time. And the final thing that you mentioned also in relation to the sperm was the sperm chromosomes. What can one of those tests determine about that?
Well, so let me just kind of go over what we do when we look at the sperm and the semen. We look at the volume, which a typical specimen is between 1 and 4 cc's or milliliters. Mm-hmm. We look at the count. The number of sperm should contain 20 million or more for pregnancy to occur, and so count is important. We want to look at their ability to, the motility or their ability to swim. We want to see about 60% of the sperm swimming on this test. Mm-hmm. We look at their morphology, which is are they normally formed? And then we also will do a white blood cell count just to make sure that there's not an infection going on there.
And that's a blood test?
No. These are semen analysis
okay.
that you're going to get this from. Now, in the same holds true with the DNA testing. The more sophisticated, more recent things that have come up is that looking at the DNA of the sperm and to see how much fragmentation there is, to see, and it really came out of IVF. Mm-hmm. And the other procedure called ICSI, which is intracytoplasmic sperm injection. Some of the awareness of these tests, of course, those are artificial methods of achieving a pregnancy. And so, but the semen analysis, nevertheless, should always be a part of the fertility basics.
Fertility basics. So that's, I guess, kind of covers a general overview of how you evaluate a men's fertility. I wanted to ask you about the third question I had, which was what can harm a man's fertility? Now, you had spoken about some specific conditions that are related to the reproductive organs of the man.
Right.
And here are some that you listed specifically.
Well, a varicocele is basically it's varicose veins in the scrotum. Mm-hmm. And it's a common reason for infertility, up to 35% from the male factor. 15% of the general male population has varicoceles. And there's no risk factors for this. We know that being overweight can increase the risk of it, but there's no other real risk factors for it. And so there's usually a surgery that they can do because it does result in a decreased sperm production and quality.
Now, is a man normally aware of this? Is it painful or obvious? Or
not usually. It's a certain, when you examine a male, it's known as a bag of worms. That's kind of it has that feel to it, and it would be done on an exam by a healthcare provider that it would be discovered. And so that implies that a guy should have an exam if there's any issues with fertility. And so the second thing I have on there is epididymitis, which this is an inflammation of the epididymis, which is this convoluted tube that's on the back side of the testicles, and the sperm go through there to the vas deferens, which the vas deferens then go forward through the prostate gland. And this is a result of most often having an STD, like gonorrhea or chlamydia. And it's most common, as you might suspect, in men of young ages between 19 and 35. And so it's a bacterial infection, and they can get really sick from this. They have fever, chills. They don't feel good when they have this infection. And so that would need to be cleared before a man could, or it could affect his fertility. So.
And so then STIs in general, they could lead to different conditions?
Well, a decrease in their fertility also, yes.
They could affect their sperm count and so on. Well, then further you had talked about, not just the things that deal with the men's organs, but about the general medical condition. And
Right.
you said cardiovascular function was a particular
Well,
interest.
okay, so some of this is because older men are seeking to become fathers.
Oh, I see.
And when people age and they have cardiovascular disease, what do? We put them on medication. Some medications are going to affect fertility. Diabetes, we're going to see more problems with what the old-fashioned term was impotence, erectile dysfunction. We saw more of that. Some of the cardiovascular meds really wipe out the libido. So it's not just the issue of not being able to get an erection, but for some men, there's no desire for intercourse.
So that's the side effect of medication.
Right. And then age, sometimes stress comes right along with that. If you think about a man in his career and where they're at with that, so that can be a function of age. Although that's not to say young guys don't get stressed. They do. But I'm really kind of talking about the older guy. And then low testosterone is receiving a lot of press, if you will, and that I think there's a lot of research that still needs to be done because I'm not so sure that we all have a really good understanding of when you treat, how low is too low. Certainly if there's an effect on the quality of his life, it would need to be addressed. Symptoms guys get when they have low T is moodiness, weight gain, they get a loss of muscle mass, and they have diminished sex drive also.
So does that affect your fertility then, or just more like you're saying, maybe their sex drive or something like that?
Well, if it's low enough, certainly it's going to affect it. It's a hormonal disorder. And then, but I would think more so it's the quality of life that it could potentially interfere with. So, you know, if a guy's having those kind of symptoms, he really should go in and be seen. And then the normal testosterone range is about 300 to 1,000 nanograms per deciliter on a blood test. And so it's a simple test to do to find out where he's at with that. Because, you know, you could be depressed and get some of those same symptoms. And so that's why health care is needed to rule out that as a reason.
Right. So you want to pinpoint what the actual cause is. I have on here listed also stress, and I wasn't sure, I don't think it's necessarily a medical condition like maybe diabetes is, but does that have effect on a men's fertility? Or?
Yeah, sure it does, and I'll tell you how. And maybe not in the way you were thinking of it, but DNA damage. Oxidative stress is one way. It's been implicated in male aging and decreased fertility. We have oxidative stress that's seen with age, and it negatively affects the sperm's quality and function when you have oxidative stress. Now, what are the kind of things that cause oxidative stress? Well, if you think about inflammation, that's a good way to think about it. Inflammation is being implicated in so many of our disorders that we have. And so, you know, the Western diet is notoriously bad. Melatonin in the sleep. Melatonin is a great antioxidant. So it's your anti-cancer hormone because oxidative stress is thought to be about getting cancer.
And that's also related to sleep. So if a person is maybe stressed and not getting enough sleep, that can also cause?
Yeah, sure. You're going to see stress on your body that way. Some of the foods, some of our stuff in the environment, that's a whole talk in itself probably. But they're just the idea that advancing paternal age, you're going to see more of that. And so does healthy living counteract effects of age? Well, only to a certain degree. But
Well,
it certainly
that's something
isn't going
I
to hurt.
wanted to ask you about. In fact, I have here the next one is, do men, like women, have a biological clock? And you were starting to talk about that.
Yeah, they do. Overall, semen quality peaks around the ages of 30 to 35, and then in a study that was done, they found the lowest after age 55. The ability of the sperm to swim was best before the age of 25 and lowest after age 55. And so, yes, there is
so the belief that men can father children at any age, into old age, is probably not true.
Right. It's not exactly true. We are, okay, so we're very focused on women and testing for Down syndrome, for example, because it's been long recognized that that's a function of advanced maternal age, and they've tied it to the egg and DNA damage in eggs. But older men also have more DNA damage, and so then you'll have that increased risk of miscarriage and increased risks of some birth defects, as well as the decreased fertility. So it isn't that older men can't father children, but who are they fathering the children with? They're not fathering the children with older women. They're fathering the children with younger women. That's long been the pattern in our society. So we don't know. It hasn't really been measured about that particular how that comes out in birth and what have you. I've never seen a study where they took they saw a rate done by the couple's ages, like in combination. I've never seen anybody study it quite that way.
So it sounds like you're saying that, yes, the age matters, but there's still some things that are uncertain.
Right. Exactly. The overall review of the literature doesn't give us a clear consensus regarding the implications of advancing paternal age. But in general, we would say that the aging sperm undergo subtle changes as a man ages. It's not the same rate as we know with an aging egg.
Well, that's good to know. I mean, it's certainly, if you are older, there's nothing you can do about it, but perhaps it will help some people not to delay too long. The next thing that I wanted to talk about, so we've mentioned about the medical conditions and age and so on. I'd like to start on kind of the meat of our discussion, which is that fourth question, what can a man do to support his own fertility health? And I think what you started to say and what I wanted to ask you about is establishing healthy habits. Now, we mentioned obesity before, and I think that that's one thing, of course, that men can do something about. And you had mentioned about the importance of BMI or body mass index.
The man should have normal BMI, which I think the top limit of that is 25. So if he gets himself normally weighted, it's a really good thing to do. It's healthy anyway. Think about my whole point about mentioning cardiovascular disease and diabetes. Those same things that we preach to prevent cardiovascular disease and prevent diabetes are the same things that make your fertility more healthy.
Well, and you had mentioned a statistic earlier on in our discussion about for every certain amount of weight.
Every 20 pounds a man is overweight, his risk of infertility goes up 10%.
Wow, that's quite a statistic. And so when you're talking about his fertility, you're talking about all those things we talked about with the sperm. So either it could be less or deformed, those sorts of things. Is that what you mean?
Right. It alters the semen. You don't make as good quality semen when you're overweight as you do when you're normally weighted.
Normally weighted.
Basically, that's how you could think about it.
Right. I guess it's not surprising then that the remedy would be the same remedy then for a number of health issues, which would be to address your diet and to address exercise. So what are your recommendations then for especially exercise? You see a lot of people at the gym just going hard at it. Is that what's necessary, or what would you say?
No, I think the key is moderation always, and I think a guy has to take care of himself and make sure that he's wearing protective equipment, especially if he's in contact sports. Now, the other thing is the guys that you worry about are the guys that, guys who ride bicycles, who wear those Lycra suits.
Sure.
You know, we've all seen them. Well, the problem with that is it increases the temperature in the scrotum. And the scrotum has the function of keeping the testes cool. And so those little Lycra suits, or the friction of the cycling itself, is really not very healthy for his fertility.
So you should be.
So the type of exercise makes a difference as well.
Yeah, and going to the diet, I wanted to ask you about this table that I had seen you put together, and I extracted your recommendations for the men. I see in particular you have listed a lot of things about fats and oils. So if someone's looking at their diet and they're thinking about fertility, what's bad and what's good, and how does it make a difference in regard to a man's fertility?
Okay, so I just want to say something about this table, is that I didn't mention protein on here, not because protein isn't important, but this is sort of in addition to think about other issues. We all need a good amount of high-quality protein in our diets. And if you go to the government website for the dietary reference intake, it's 0.8 grams of protein per kilogram of body weight. But that isn't very much. It's 56 grams a day for an average sedentary man. Actually, people need closer to 75 grams of a high-quality protein intake. And it depends on a person's age, their muscle mass, their physique, and their current state of health as to how much they need. But you need a good amount of protein for to support your metabolism.
What would that look like? So 70 grams, is that a hamburger? Is that
well, that's more than that. You know, I'm a lover of eggs. I am. And I see eggs as really healthy food because they have all 21 amino acids. They're a complete food. It's not necessarily the red meats, but certainly you need to include meats in your diet. Fish, the right kinds of fish, chicken, pork. You do need some of that in your diet, and nuts are high in protein. Bison, if you have access to bison, very high in protein for a 3-ounce serving.
Is that true?
You've heard what?
I've heard it's very lean.
Yes, it is. And then think about, if you're going to eat yogurt, get Greek yogurt because it's higher in protein. You know, and the beauty of this is that it kind of smooths out your blood sugar during the day. You feel better when you've eaten an adequate amount of protein. And so, and then if we talk about nuts, we need to talk about healthy oils, which you need to get enough omega-3s in your diet. And like for that afternoon, when you're coming home from work and you're not going to be eating dinner for just a bit, you know, a handful of almonds is a really good snack. And I'm not talking about the toasted ones. I'm talking about the natural ones.
Like the raw almonds.
Yeah, exactly. Very healthy for you. And so the avoiding of trans fats, because I was stunned to see that there was a researcher named Chavarro who works out of Harvard. He actually looked at the effect of trans fats directly on sperm, and sperm pick up the trans fats, and it does interfere with their function. So you don't want to be eating trans fats.
So that's interesting. The trans fats is not just about maybe leading to obesity, but they have a special effect on the sperm itself.
That's right. Exactly.
That is interesting.
And then, of course,
a lot of people may not know that.
Yeah. And so the issue of the liquids that you take in, drinking water obviously is really the healthiest. Now, I have avoid sodas there just in general because they're empty nutrition, but there was a study of Danish men who they looked at white soda intake, they looked at colas, they looked at caffeine intake in particular, and it was the guy who was drinking 3 colas a day and equivalent that was the man who had the lower sperm counts than those who did not drink that. And so we know that caffeine has an effect on the sperm production.
That's also good to keep in mind. Now, I wanted to go back a little bit to the issue of sports, and you had mentioned cycling, and there was another thing I saw in your article, which was steroid use, which is kind of ironic because, it's connected with a masculine thing of building up muscles and so on. But what would be the danger then toward fertility with using steroids?
Well, anabolic steroids, if a man is using enough of them, they make him sterile. And so they really reduce a man's fertility to use those things, ironically.
Yeah, that is definitely ironic. So you're saying that their sperm production would cease?
Yeah, it's going to eventually cease. But because it's going to interfere with your hormonal balance, and so it's just not a good idea for a guy to be doing that anyway.
Right.
But as far as and if you're a male athlete, you're going to end up in your major league ball player. You're going to end up in front of Congress if you use them right.
That's right. I guess they're not legal in any case.
Yeah. So. Anyway,
well, and you had mentioned cycling and the shorts, so I guess I don't know if there's any other sport. I guess just the protective wear you were talking about.
Right.
So,
with contact sports.
The cup or so on with baseball or football, any of those. Any other thing with sports that you might caution with?
No, I mean, really, that's...
Like some people do extreme sports, like maybe Ironman or very intense sports. Does that have anything to do with fertility health at all?
As long as...
like a very high heart rates and that sort of thing.
Yeah, and I can't tell you that I've seen anything about extreme sports, but just in your, if they're trying to conceive a baby, just in your mention of the word extreme trigger something in me because the whole idea of moderation is really kind of an important one.
Well, I guess keep moderation in mind then, even if you're unsure. But
well, just in general, that's my reaction to that. So anyway,
well, the next thing I wanted to ask you about then was, I guess, so-called substances, and here I have the ones that I guess are legal. Marijuana is legal some places, I guess, now. But I have here on the list tobacco, alcohol, marijuana, and caffeine. So
now, I talked about the caffeine already, but smoking tobacco decreases, it affects your semen volume, the sperm density, the count, the shape of the sperm. And it can cause DNA damage in the sperm. So it's really not a healthy
thing. So it actually causes the DNA damage, so the chromosome portion.
Right. And just think, when that's not, you wouldn't be surprised at that because we know tobacco is highly associated with cancer. So, and then marijuana, that is really a concern to me because we have an awful lot of positive press about marijuana. All of a sudden, because of the legalization in a number of places, but you're not seeing anybody talk about the negatives about marijuana, which marijuana in itself reduces testosterone production, sperm count, semen quality, and inhibits the ability of the sperm to fertilize the egg. So that's pretty profound.
Well, that's pretty serious if you, are wanting to become a father.
And, we don't want to take away all of his fun. Alcohol does cause some fertility abnormalities, but that doesn't mean he shouldn't enjoy a drink here and there.
So again, moderation. What are your recommendations then for moderation with any of these?
Well, I don't think that. I think a guy's got a problem if he has to drink a 12-pack on a weekend. I think that's quite a bit of beer. A drink or two on a weekend. I don't see that as any real big issue. It's more the chronic type of thing that you really get concerned about. The guy who drinks a couple of beers every night. Well, that's a couple of beers every night. That kind of, from a nursing point of view, you'd question how dependent are you on this, and could you give this up, and do you feel guilty when you're smoking, or when you're drinking, or other people, on your case about your drinking. Well, that all points us to a problem with alcohol. So, like I said, using it here and there, I don't see a problem with. So
just again, back to moderation.
Exactly, because we do know that alcohol lowers testosterone levels. That's essential. Lowers sperm counts and impairs the motility, the ability of the sperm to swim.
So all those basics that you talked about in the beginning. Now, Dr. Barron, in your article you had mentioned a range of environmental factors that men should be aware of, and some of them seem obvious, but others are not so apparent. Well, here the scrotal temperature you had mentioned, but there's some ways, I guess, that it's in danger that maybe people haven't thought about.
Right. Well, the scrotal temperature is important because you have to have the right temperature, otherwise the semen quality would be depressed. And hot tubs, you know, the guy who's using the hot tub 2 or 3 times a week is going to be the same guy that you would be concerned that he would be getting his scrotal temperature up too high. The one I'm concerned about these days are the guys that using the laptop, and they sit there, you know, hour after hour. After 1 hour of laptop use on the lap, it raises the scrotal temperature by a whole degree, which is a lot.
Mm-hmm.
That's quite a bit. And so just being aware. Now, the government has a complete page about work environment and chemical hazards. So I'm not going to say that I can just tell you all those, but you know, BPA, of course, is one of the things that's notorious, but the pesticide residue on fruits and vegetables has been associated with poor semen quality. I think there's a lot more research that has to be done, but your audience should Google the Dirty Dozen in fruits and vegetables.
The Dirty Dozen, okay.
The Dirty Dozen and the Clean 13.
Clean 13.
And that was done by the Environmental Working Group, and they looked at those fruits and vegetables which are most likely to retain pesticides, and those are the ones that should be bought organically. And to my shock, apples headed the list. I was just so surprised by that.
Huh.
And then peaches I got. Peaches being fuzzy, I thought, well, sure, I could see why it would be hard to wash that off. Strawberries is on the list. There's a number of berries that are on the list.
So apples, even though they're round and smooth and you think you could wash them easily, you're saying that the pesticide residue is difficult to remove from an apple?
Because they were at the top of the list. And, you know, I was just really surprised by that. So the audience should go and Google the Dirty Dozen and the Clean 13.
So I'll make a note of that, and I'll put it in our follow-up email. So you mentioned there is on the government website. Would that be the CDC website, or where might a person look to find out the chemical hazards or work environment hazards? Probably.
You know what?
Okay, I'm sorry, you may not have.
I think it is the CDC website. I am so sorry. I will provide an address if you can put it at your website, and your audience can go and get that, because I don't have it.
Yeah, no, sorry, I didn't mean to catch you off guard.
Yeah.
Okay. Now, I think we've covered most of the key things that have to do with healthy habit and the key harmful things and environmental things. So Dr. Barron, with your background as a nurse practitioner, you've been involved, of course, with a lot of primary care. What are your recommendations for checkups in general?
Well, when I wrote my article, I wrote it specifically to nurse practitioners who were in primary care, and the reason that I did that is because I think this has to be worked into health promotion at a visit. And what I've told you today really doesn't take that much extra time for an NP to discuss. We talk to people about not smoking anyway. We talk to them about their weight anyway. We talk to them about their diets anyway. So I think there's quite a bit of this that can be given, and I think that men need to be told the basics. They, you know, whoever talks to them about the shape of their sperm or the size of their sperm, nobody talks to them about whether or not they're making good semen or not. You know, it's not a.
And they're probably not thinking about it.
No, of course they're not thinking about it. But that's the point of fertility literacy, is that it really, your fertility health really does connect to your risk of poor health later in life. And so I think it's very easy to get this information across at a primary care visit.
Mm-hmm. Now, we are getting toward the end of our time, and I would like to get to some of the audience questions. Was there anything else you think that maybe I hadn't included here that should be mentioned in regard to men and fertility health?
No, I think we've covered it pretty well, actually.
Some of the, okay.
Oh, the sleeping thing. We didn't really talk about sleep. So in the women, when I did a whole review of the literature on the effect of light at night on the menstrual cycle, and it was only later on that I came across information for men that suggest that guys are best to go ahead and pay attention to those same recommendations. There's no sleep studies examining the effect on male fertility, but emerging information on sleep leads us to the conclusion that sleeping in a cool, dark room is optimal for everybody. And when I say cool, dark room, what I mean is that we don't think about that street light that shines into our rooms. Well, your room should be so dark that you cannot see the outline of a picture on a wall. That's just a good, quick, and dirty way to put it.
So that's pretty dark.
And then keep the room cool. You know, I think one of that a ceiling fan is like one of the best inventions ever done, because it makes you so comfortable at night, and you can throw a heavy quilt on yourself and still be comfortable because you have air moving. It keeps the room cool.
Well, that's definitely a good tip, and I'm glad that you brought it up for this discussion, because I didn't have it here on my list. So if you just bear with me for a moment, I will also put up here for our audience a way to contact us in case we don't get to your question. You can always ask us later, and we will respond to you. So just bear with me one moment. So let's see. One person wants to know, how long does it take for the person to generate new sperm? For example, if they have been having their laptop on their lap and drinking a lot of coffee and they decide to stop, when would they see an improvement?
Well, 72 days is how long it takes to make a mature sperm.
Oh, wow. It's much longer than I knew.
Yeah. So sometime after 72 days, I would suppose the right answer to that would be.
So,
and she's right to think, or whoever asked that question is right to think about subtleties and the combination of factors. You know, in terms of
so the drinking of the coffee and working late at night or something with the laptop. Because, of course, a lot of these things do come together for a lot of people, and who knows what the combined effects are. Let's see, we have another question here. What are the dangers of carrying cell phones in pockets?
Well, there's exactly one study out there that shows a connection between cell phones that I have seen, cell phones and decreasing the quality of the sperm. And so one study isn't enough to say that there's a lot of evidence to support that. Okay. So I don't really have a good answer for you.
Let's see, we'll go to the next one. This person says, our state just legalized medical marijuana. Can you talk about the fertility effects of marijuana use? Okay, so this, I think we have talked a bit about this, but was there anything that we maybe left out?
No, I think I covered it. It's pretty a direct known effect.
Let's see, can men go to a family practice doctor for semen analysis, or does it need to be a urologist or a specialty doctor?
No, they can go to a family doctor and have a semen analysis done. They can also go to Walgreens and pick up a kit.
Oh, so you could even do it that way.
You could even do it in the privacy of your own home to start.
Here's an interesting one. Does a younger male help reduce the fertility risk for an older woman? And I'm not sure what the thought is behind that, but interesting.
The answer to that is we see more DNA damage in older eggs. That's really been a long established fact. So I don't know that I would have a good answer to that combination, because you would still have the problem with the older eggs.
With the woman.
But there are many women. The thing about it is in my personal opinion, we really obsess about Down syndrome babies in our society. We really have scared women to not having babies, when they're 40 and what have you. Now, at the age of 40, only 35% of women can get pregnant and maintain a pregnancy, and by the age of 45, only 1% of women can get pregnant and maintain a pregnancy.
So that's quite
and
a
then
drop.
somebody will always say to me, but so-and-so is 47 and she just had a baby, and I'll say back, you have heard from every 47-year-old that ever got pregnant. It isn't that there are so many of them out there. There are women out there, and some of them have had perfectly healthy, wonderful pregnancies if the woman is in good shape herself. So, but that doesn't really answer the question about the younger guy, because I really don't have an answer to that combination.
Right. And it might be an arbitrary thought anyway. Well, we are running out of time. I have one more question here that is perhaps interesting to discuss. Do ED medications, so I suppose like Viagra, do they affect fertility?
I do not know the answer to that. I'm sorry.
No. Well, that might be something.
I don't.
Maybe there's no evidence yet, but maybe that might be something for our future postings.
Right. I'll have to look into that now.
Right.
They gave me a job.
Okay, well, we have run out of time. I'd like to thank you so much, Dr. Barron, for joining me today to talk about men's fertility health. It's an interesting topic, and I hope it does inspire any men or maybe their partners listening here to consider their fertility health. For our live webinar audience, we'll send you a link to this recorded webinar. And again, as I mentioned before, if you have questions, maybe think of something later or that didn't get answered here, please feel free to contact us through email, Twitter, or Facebook, and we have them all listed up there. Thank you again, Dr. Barron, and I'd like to say goodbye to everyone. We're ending the webinar.
Thank you.
Okay, thank you. Bye-bye.